Very good evening, friends from Bangladesh and India. We are extremely fortunate to have Dr. S. Karunakaran with us from Chennai Global Hospital. Dr. Karunakaran is also the director of Institute of Advanced Spine Sciences, and he's one of the most reputed spine surgeons of India. In fact, I can share experiences of many of our patients of Shastho Bondhu, whom we have sent to Dr. Karunakaran, and we've got some excellent feedback from them. And that is what pleases me today as the founder of Shastho Bondhu to have him with us and to answer to queries of many of my friends who've been calling me. Even just before we went live, I got a call that people want to ask questions to Dr. Karunakaran. So the platform is open now. You can start asking your questions. But before that, I will just give a brief introduction of Dr. Karunakaran for people who don't know him. Although he's a celebrity, but let me present this celebrity to you. Dr. S. Karunakaran has an overall experience of 25 years and is currently working as an associate professor of spine surgery. He has pioneered in percutaneous endoscopic lumbar discectomy under local anesthesia for disc prolapse. He is the first in South India to have used in-space interspinous plant for lumbar casual stenosis, keyhole spine surgery, local anesthesia. He has performed more than 1,000 spine surgeries, amazing, 1,000 spine surgeries by a doctor. He has presented various papers. He is also an esteemed member of Tamil Nadu Orthopedic Association, Association of South Indian States, Association of Spine Surgeons of India, and Asian Academy of Minimally Invasive Spinal Surgery. In fact, he's got a lot of accolades. He won the Mohandas Weller Gold Medal and Fellowship Award at the 10th anniversary meet of the Indo-German Orthopedic Foundation. He has also, got the best publication in Tamil Nadu Orthopedic Association Journal in 2010. His expertise mainly lies in scaleless spine surgery, scoliosis and physis revision, percutaneous endoscopic lumbar discectomy, cervical spine pathologies, thoracotomic and lumbar fusions, laparotomy, disc replacement surgery, spinal cord injury, and rehabilitation. Very difficult words for me, but I tried my best to use the right pronunciations for them. But he is a man with a wide experience. That's what we understand relating to spine. So we have with him today Dr. S. Karunakaran. Dr. Karunakaran, a warm welcome to you.
Thank you very much, sir. It's really, I am delighted to address this gathering. For those nice words, I am very grateful for that. I am quite excited about those good statements about me. I basically, my concept is very simple. Try to make as many people as better and happy and get them back to work. If I could do that, I'm very much satisfied.
Right. Doctor, I would, yeah, Doctor, I would request you to tell us, the typical problems that people face due to back pain. Why do back pains happen? What is the reason of back pains? And what has it got to do with spine? Today only, someone called and asked me, is a back pain got to do with orthopedic or a neuro doctor? Whom should I go to? So, these basic idea of what a back pain is, how it happens, and what should people do? If you can give a general idea about this.
Yeah. See, it is always back pain is one of the commonest health issues, which can be as simple as just an hour or two or so manifestation, or to the rest of the life they could be suffering. It means that it could be as superficial as at the skin level. I literally mean skin level. We have seen patients at skin level. Some of them have these herpetic lesions and they present with back pain, and they keep doing MRI, X-rays, bone scan, but still, if you had a look at the skin,
Excuse
we
me,
could have.
doctor. Excuse me, doctor. We have with us Rushaida Hakliba, whose reports I had sent you, whose father's reports. So, Rushaida, I would request you to give us 5 minutes. Doctor is speaking and giving a general idea about, spine and back pain. Once he finishes, you can send your questions to us on Facebook Live. We will be glad to ask him your questions. Yes, doctor, continue.
Yeah, as I said, it could be as superficial at the skin level, which could not be picked up by any MRI or any bone scan or anything unless we have a good clinical examination of the skin. So, and it goes layer by layer. It can be from the facial layers, which they call as the myofascial pain syndrome, which will always be lingering in the back. It is predominantly because of the mental stress and anxiety and poor sleeping habits, lifestyle problems. The next comes the muscles, which can be due to regular repeated activities, which we call as cumulative trauma. You misuse the back again and again, which is maybe due to bad posture, or mechanically you keep doing something like lifting a weight or long distance travel, exposed to lots of these vibrations, or particularly when you travel in a very bumpy road, or your vehicle's shock absorbers or the seats cushions are not well maintained. And it comes to the people with predominantly long duration desk work, where the muscles become contracted, they're not strong enough, and or it is very flabby. Those are very common things, and it can be as serious as a tumor, or it can be a very simple back pain. So we don't have to think all back pains are very simple. Neither it's too serious to an extent it is a tumor. So the thing goes like this: you have to evaluate each and everybody's symptom differently. So people always say, I discussed with my friend and he said his pain and my pain was the same. It can be, the pain can be from the same region, but it can be a different pathology. So all back pains need not be disc-related back pains.
Fantastic. Doctor, I have a small question for you. People have this question, they have been asking me that is it necessary, if, I have to do a spinal cord surgery? People are scared of surgery. So when is it that a surgery is needed of the spine? When is this a requirement that one needs to do a surgery?
Yeah. See, I would just share you an example. Like today, I had seen a gentleman who had been suffering with back pain, and it has been coming down his right leg for almost 2 years. So I was just asking him
Mhm.
out of curiosity what had prevented him from not taking the appropriate treatment, which has been advised 2 years back, has been surgery. It means the symptoms are severe. His lifestyle has been disturbed. He is not able to perform his activities to the optimum. Because of that, his stress level is gone, and it has percolated to all his family members. And the total system is now shut down. But what I had now brought him is the fear, the fear
Mhm.
that
Oh,
whether he would get paralyzed. Okay, that is only had brought him. But what I would say is, even now he's not going to get paralyzed. The fear about the information he's got that he's going to get paralyzed has brought him here. What I would say is, the spine surgery a surgery is an art. So it has to be very appropriately used to the people who really need it. Not the all the discs which have got a bulge or giving sciatica have to be operated. So the humble request is, each and every individual has to have a very good connect with the doctor. They have to feel free
okay,
to talk what exactly is happening to them. They don't have to be
okay,
worried about what do they see on the MRI. So they have to
okay.
tell what is their problem, what are the things which are being disturbed, and to what extent it is disturbed. The very important thing which they must be concentrating is their bowel habits, whether they got good control to pass motion, they got good control of the urination, or is there any progressive? This is day by day, the numbness is progressively increasing, or there is a sudden numbness or a progressive weakness. These are all situations which is a must situation. And the rest of the things like lifestyle modification, where if you're not able to, or it has been stressing you too much, and you have not found any sort of remedy, and those situations you would say you can undergo a surgical procedure to give you a better outcome and get back to your normal lifestyle as soon as possible. So,
Great.
in summary, the point is if there is a progressive numbness or weakness, or very important is there is a sudden loss in control of urination or motion,
Hmm.
then you would be an ideal candidate for surgery.
Okay. Okay, Doctor, we have with us Dr. Rushaida. Rushaida, yes, I think,
So,
Doctor, I had sent you the MRI and X-ray reports of her father, Aminul Haq. So now she
yeah,
has a question.
yeah, I have
What
gone
would
through
be the
the
yeah, what would
yeah.
be the preferred treatment plan for my father? How much time would it require? And can it be treated with laser surgery? And approximately the cost details, Rushaida, we will discuss about the cost later, not in this program, but we will just have a general idea about, what would be the treatment, what kind of a treatment your father would need with the kind of problem, at least with the reports that Dr. Karunakaran has seen. Yes, doctor.
Yeah.
And he's
Based
78 years
on
old. One more thing,
yeah, I
Dr.
got it.
Rushaida said he's 78 years old. Yeah,
Yeah.
right.
So as long as he is active and he is well motivated individual, the age will not be an deciding factor. So what
Yeah.
I could read from the MRI reports is that he's got multiple level disc issues as well as the alignment issues, both in the cervical as well as in the lumbar region. And particularly in the lumbar region, in the lower back, his spine is now started bending. So it is now a bent scoliotic spine. And it says he's got a grade 1 listhesis. This means that the one bone had slipped over the other, and there is going to be lots of loading of the facet joints. That is, the joints are undergoing a wear and tear process. So those things are giving the pain for him. So one important thing I would like to know is what is actually his symptoms, because I'm seeing features, radiological features both in the neck as well as in the back. So I need some clinical information. What exactly is his complaints? Is it got numbness in the
Yeah.
hand or the leg? Is he got only back pain?
Okay. So I think Dr. Rushaida, Dr. Karunakaran has certain questions that what are the problems your father is facing? Is there any numbness or what kind of pain is he facing? So if you can at least share with us on Facebook Live the kind of problems he's facing, then Dr. Karunakaran would be able to throw a better light of what could be, the treatment plan like. So it'll be great if you can share with us that, what, he's facing. Doctor, I have another friend from Bangladesh. His name is Roton, and Roton has sent a general problem. He says, I feel back pain, I think, all the time now, and also feel pain at my spinal cord, also pain in my left leg. So his questions are this: that I have back pain, and I also feel pain in
Yeah.
the spinal cord, and I also feel pain in my left leg. So he wants to know, what could be done. Okay, Rushaida has sent an reply. Rushaida is just saying excruciating pain, back pain, excruciating back pain. This is what, but no numbness. She has made it very clear. No numbness, excruciating back pain. This is what she said. And bowel and
Okay.
bladder habit normal. Bowel and bladder habit normal. This is what she's written.
Okay. See, I would take this gentleman step by step because first is to know from where the pain is coming. Okay. Since he got
Mhm.
multiple worn out spine junctions, whether it is from the facet joint or from the disc, is what we want to identify. So, what I would do is first put him on some injections and see if he's getting some relief as a first stage. If he's getting better with the facet joint injections, I would brace him, give him a support, considering his age, and see how he is doing, how his improvement is, and then decide about whether he requires surgery or not.
Acha, Rushada has again sent something. She's saying, but shooting pain to both legs. Shooting pain to both legs. This is what she's saying.
Okay. Again, the shooting pain, there are two types of shooting
And
pain.
it
One is,
originates from the anus. He's saying it's originating from around the anus. The pain originates
okay,
from around the anus.
okay. So, we need to know whether this pain is really a radicular pain or a referred pain. So sometimes the worn out facet joints, which are by with every time in the move, they can give a radiating pain down the leg. And if it is movement associated, it is predominantly a facet or a joint related issues. If it is even present even at rest, that is when they are just sitting and it is progressively increasing as they walk, the shooting pain, it would think about a foramen pathology, like it can be from a disc or the same facet joints could be narrowing the canal and giving that sort of irritation. So as I said, for these situations, the good thing would be to give an injection and see how they feel after that local injection or the steroid, and based on which we can take it further in addition to our clinical examination.
Great. So I think Rushaidi, the answer is very clear that if you can possibly come to India, possibly come to Chennai and meet Dr. Karunakaran with your father, then he will really be able to diagnose it properly. He is not saying right now immediately you need a surgery. He's saying initially he would put your father on some steroid injections, would observe, and then post observation he would then take a call of what has to be done. Some clinical examinations also he would do in order to have an understanding, and then maybe after the injections, looking at the state of his affairs, he would then decide on the future course of action. Am I right, doctor, in what I
Perfect,
summarized in
perfect,
whatever you
perfect,
said?
perfect.
Yes.
Yeah,
So
yeah, yeah.
Dr. Rushada, I hope, yeah, doctor, yes, please.
Yeah, just a small change. We will just give a local anesthetic as a first step and see if this local anesthetic is helping. Then we would give a steroid for a longer duration of action.
Okay, so first a local anesthetic injection, then a steroid injection, and then see, and then take a call of whether at all we need a injection or an operation or any kind of invasive, operation or invasive like laser surgery, all that stuff or not. That comes at a later stage. Right now, he is not talking of a surgery now. Am I right, doctor? You're not talking of a surgery now.
Correct, correct, exactly.
Right. So
We
I
need to
think
know the source.
Dr. Rubaida, are you happy with the answer? Like, is it good? Like, I hope you have got your answer. You okay? She's asking again. How long might it take? What is this question? How long might Rushaida? We couldn't follow your question.
Yeah, yeah.
How long might?
I can get a question. I question
Oh, you
because
got the
the
question.
time
Okay.
is,
Yeah.
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 So I feel that the time is must be a constraint. So we would just have to put the injection, wait for 2 days, see the patient after 2 days. If it 80% of the pain is gone with those injections in the targeted area, then we would target that area as a treatment option. Like we can either do as she was asking about laser, we use another technique called the radio frequency ablation of the facet joint. So we put in an endoscope, see those nerves which are coming to those joints, clean off those nerves, so the pain carried by the nerves doesn't go to that spot and generate pain. So we burn off those nerves which carry the pain, putting an endoscope and washing it off. It's a 1 day procedure. So that once we do this procedure, the patient can go back.
Fantastic. So altogether, you're saying not more than 3 to 4 days.
Correct. Correct.
Great. Fantastic. Okay, doctor, as we were talking to Dr. Rushaid, I've got another question. The question
Mhm.
is from Jewel from Chittagong, and his question
Yeah.
is: I am suffering PLID bracket L3,
Okay.
L4, and L4, L5. Now I got
Okay.
foot drop, left foot drop. What do I do,
Okay.
sir? What do I do, sir?
Yeah.
This is his question.
This is the situation where we must get it operated at the earliest.
Okay, this is where operation is a must. Jewel, so that's the
Yeah.
answer for you. This is where
Yeah.
operation is a must, and the sooner you do, the better it is. The sooner you
The
do,
better
that
the
better it is.
results. The
Yes.
better the
So
results.
later, otherwise, it will happen with that gentleman, which Dr. Karunakaran was sharing a story that he was
Yeah.
scared of operation, but now a time has come that he's thinking he might get paralyzed. So
Yeah.
you shouldn't take yourself ওই জায়গায় নিজেকে নিয়ে যাবেন না, don't stretch to that extent. So you can
Uh,
always contact Shastho Bondhu. My phone number is +91 98 307 01104. আবার বলি 98 307 01104. You WhatsApp me all your reports. I will send it to Dr. Karunakaran and we will get you a treatment plan. So don't worry, we are there. We'll help you out. Absolutely not a problem. So Rushaida has thanked Dr. Karunakaran. Thank you so much, he said. Rushaida, I hope you're happy with the answer that you got. Now what you need is you let us know when you want to come to Chennai. We will send you the invitation letter from Global and we'll get everything organized for you and your dad. So you don't worry, leave it on us and we'll get it done. Somehow we've lost Dr. Karunakaran. We've lost him. So I hope he'll be back very soon. So I hope all of you
sure.
are enjoying this program. It's a very informative program because back pain is a yeah. So Dr. Karunakaran is back again. So doctor, going back to the problem, my friend Ratan sent that I feel back pain and also feel pain at spinal cord and also pain in the left leg. So what is your advice? Is it going to go through physiotherapy, exercises, or what is your advice?
So there are two things: the duration of his suffering and how acute is it is the symptoms. If it's
Mm-hmm.
there are two things, and all leg pains need not be from the disc itself.
Mm-hmm.
Okay, it can
Okay.
be from your the pelvic joint. It can be from the muscles in the pelvis. It can be because of other reasons like we see patients with diabetes, with uncontrolled diabetes. These individuals also have the sort of radiating pain, and sometimes with a lesion in the pelvis or the abdomen, they also present with these sort
Doctor,
of
I'll
symptoms.
just take a second from you. Mr. Sampath Barua has joined us and he wants my number. Mr. Barua, my number is +91 98 307 01104. Again, I repeat 98 307 01104. So, if you have anything that you need me to specifically ask Dr. Karunakaran, you can send your reports to me. I will send it to him and we will send you a treatment plan. I hope you got my number. Yes, doctor, continue. Sorry for the interruption.
Yeah. So the thing is, it can be from different sources. The radiating pain. The first is to
Mhm.
correlate the symptoms and the imaging and the clinical features. The three things have to match. And if it is
Okay.
matching and the symptoms are mild, we would go through a non-invasive procedure. So it means that we would do focus on postures. We would focus on the support system, like using a lumbosacral belt, or we would, in addition, use some physiotherapy modalities. It can vary from laser therapy to shockwave therapy or traction devices, discal decompression therapy. So many things will be there. And if there is going to be a confusing element, as I said for the other gentleman, where we need to use injections, we also use injections around the nerve, not like the spinal injections, around the nerve, to know which nerve is getting irritated by putting an injection. So the very important thing is the doctor has to be very patient enough to listen to the complaints, and then based on the complaints, we have to customize treatment. Different people have different level of pain threshold, and the complexity of the same disc problem is variably manifested. So we need to customize and accurately deliver based on the all three features: the symptoms, clinical features, and the image.
Great. Doctor, I would, Miss Tasfia Said Shifa has, I think,
Yeah,
some
she wants
question.
to know whether I'm an orthopedic surgeon
Yeah, yeah,
or a
yeah,
neurosurgeon. I'm
yeah,
basically
yeah,
an
yeah.
orthopedic surgeon specialized in spine surgery. So
Hmm.
there is two divisions of people who do spine surgery. One is the neurosurgeon as well as the orthopedic surgeon. So whoever is focusing on in this field would be a good candidate for spine management.
Great. I would like to share a small story with the audience about Dr. Karunakaran because I've been asking him questions, but I think people should know a little more about him. We had a patient from Joshore. His name was Binoy Mollik. Mollik Sahib, I don't know whether he's tuned in or not. He had come to us and he was thinking that, the kind of problem he was having, he would need a spine surgery. So we sent him to Dr. Karunakaran. And what he told me when he came back was Dr. Karunakaran spent so much of time with me explaining to me what had happened to me. This is exactly what Dr. Karunakaran just said, that, the doctor has to be patient with the patient. If he is not patient with the patient, he will not be able to give the right diagnosis. And this is the secret of Dr. Karunakaran's success as a spine surgeon, is that he listens to his patients. He is very patient with his patients, and he has got a heart for his patients. He's very empathetic towards his patients. He is not just a doctor who's there to use his, scalpel and do his operations. He doesn't, and in fact, he is the kind who told Mr. Mollik, you just do exercises, do physiotherapy, take medicine. You don't need anything. Go back. So this is the kind of doctor Dr. Karunakaran is. So if you are really looking at, a real, true, honest opinion about your spine or your back pain, I think Dr. Karunakaran is the right doctor to go to, because he will guide you correctly. He will not push you to an operation. People are scared of operation, but he will not push you. He will only tell you when operation is absolutely needed. He'll tell you, and that too, he will do it in a way that there is no fear. There is absolutely no fear. Another patient from Bodisha, Lahasunullah, had gone to Dr. Karunakaran. He got excellent, recovery from him. So that's what I'm trying to say. যে আজকে আমরা ডক্টর করুণাকরণকে এই জন্য নিয়ে এসেছি, this is the reason we have got him today, is because we have heard so much about him from our patients. They have praised him so much. So we are so delighted. Dr. Karunakaran, believe me, it's a great delight to have you with us.
I'm very much pleased to get these sort of nice words from people around from your country. But the thing is, every time when the next patient comes, when I say surgery, sir, they said you will never tell surgery. No, I have to correct this in this context, because when it is necessary, I have to do it. I do it. When if it is, people should never come with a monotonous thought process that I don't choose the patient for surgery. See, there are people who are not been properly educated about their problem, and they all been thinking if there is a bulge or something which has come out, it will never get repaired by the body. So if we give the adequate time for the body to repair itself, it is under supervision. It has to be done. If it is done under supervision and it is getting better, we would just follow them up periodically. The commitment is, this spine care is always a commitment between the patient and the doctor. So there is a connect. It's just not operate and leave and go, send you back home. You have to be connected in a long-term follow-up. We need to know what sort of exercise you're following. Is there any challenge during the post-op? You have not able to practice certain things. Get back to us. So we come up with a solution. We might be very innovative in certain solutions also, because everybody's demands and situations are going to be varied. So it is a team effort between the participation between the doctor and the patient is the key, I think, for a good result.
Fantastic, doctor. Dr. Babul Hussain from Bangladesh has said MRI of cervical spine with screening whole spine. Where is that? I couldn't follow what you meant, Babul. You understood?
No,
yeah.
But he has not mentioned what his symptoms are. But he has just mentioned he has undergone an MRI. But
So Babul bhai, apna problem tha ki? What are your problems? Why are you like? What is it that you are suffering from? If you can share with us, the problems that you are currently facing, then we can ask Dr. Karunakaran. He can give you some advice. তো আপনার সমস্যাটা একটু কাইন্ডলি লিখুন। কোথায় আপনার যন্ত্রণা? Where are you facing pain? Are you facing any numbness somewhere? কোথাও কোনো numbness হচ্ছে কিনা? অবশ হয়ে যাচ্ছে কিনা কোথাও? একটু কাইন্ডলি আমাদের আরেকটু ইনফরমেশন দিন। So okay, Sampad Barua has sent, I face foot drop for PLID. Now continuing physiology and little bit of improving. Please send your valuable advice. My age is 40. So he says facing foot drop for
Yeah,
PLID. Did you
yeah,
understand this,
yeah.
doctor?
Yeah, the
Yeah.
PLID stands for prolapsed intervertebral disc. So that is what
Okay.
it means by prolapsed intervertebral disc. See, I see when the surgery can be done in a very effective way, like trying to preserve all the structures and and, and targeting only the damaged part. Like what we do is an endoscopic procedure, where we don't have to be worried that we are going to cut the normal tissue and for the purpose of addressing the disease disc, we don't have to cut any normal tissue. Here, the endoscope goes directly into the target area, that is the prolapsed disc or the damaged part of the spine, and see in detail what exactly is happening and vision without having the chance of making an error. We can remove it immediately and allow the nerve for it to repair as soon as possible. Instead of wasting time thinking that it would help him, it would cause rather more damage by doing in a foot drop patient. The more the compression, there's a delay, it is going to have a negative impact. Though he's
He's
only
saying
a
that
young
he's doing
man,
physiotherapy. Will physiotherapy
yeah,
really help? He's doing physiotherapy.
yeah, physiotherapy does help. But what I say is, you apply brake and you're continuously accelerating. It is not going to help you to move forward. There's a brake is the disc, and therapy is trying to improve. But applying a brake and accelerating will not help you to go forward. What I say is, you have a disc which is compressing on the nerves. Let it go. Allow the nerve to recover, and then continue your physiotherapy. It will be fantastic. Always this multimodal approach is better than a single strategy. Like don't go only
Mr.
surgery, don't
Yeah.
go only physiotherapy.
Mr. Barua, so I think Dr. Karunakaran was very clear that you need an endoscopy to be done, and wherever the compression is happening, he says through endoscopy only. It is not a surgery through; it's an endoscopy through which he can actually
Correct,
help you
correct.
to remove the bulge wherever the compression is happening. Post that, if you do your physiotherapy, you will see a much faster improvement than just doing physiotherapy. So physiotherapy will not help you to move forward, it will just halt the progress of further damage, but the damage that
Yeah.
has been caused has to be first repaired. So he's saying that you repair it through endoscopy, which is not doctor, is it a very complicated procedure, endoscopy? Is there any risk in endoscopy, any kind of risk
No,
somewhere?
the technique which we are practicing is the sutureless percutaneous endoscopic discectomy. The sutureless meaning, why we say sutureless is because there are different types of endoscopy. Here, you just have to make a small puncture, like make a puncture and connect a communication between the disc and the exterior. So we can put in a scope, directly visualize the spine. So we don't have to cut muscles, cut ligaments. We directly go make a small rent in the spine and go see the disc and come out. So the same day the patient can go back home, and the relief is also instantaneous, and you can work quickly on
Amazing.
the muscles. Yeah, yeah.
Amazing.
So
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 it's a very
these things
simple
are not
thing. What
new.
you're saying is very simple. It's a very simple
Yeah, but
procedure.
yeah, yeah. It's so simple, and we are unnecessarily complicating because it has got a tag surgery. So once the word surgery comes, everybody backs off, saying that something is not right. But the surgery has gone through lots of refinement and is so advanced, and we have been almost practicing this for almost 15 years. And we find that the results are definitely rewarding, and the patients have been very grateful to what we have been doing. So I think people should not be given the message that all the discs have to be, neither has all discs need not be operated, neither all discs have to be only physiotherapy. It should not be either way. It is based on
Okay.
individual situations, it has to be designed.
Doctor, just for the information of people who are listening to this program, how much approximately does this endoscopy cost? Like the kind of costing that an endoscopy happens.
It you see, based on multiple things, we give the costing. If it is a single room package for a single day, it would cost
Okay.
around 2 lakh rupees. If it is a
Hmm.
general ward, it would be around 1.5 lakh rupees.
So you see that there is not much of cost, Mr. Barua. within 1.5 lakh rupees, which would be approximately 2 lakh Bangladeshi takas, you can get a lifetime cure from one of the best doctors in India. So you
Correct.
see, it's not much of an amount of money also you need to spend, but at the end of the day, you get a cure, you can run, you can walk, and you can start leading your normal life. So, Sampad, you have my phone number 98307 01104. You see, it's there on the screen 98307 01104. You just send me your reports. I am on WhatsApp, I am on emo. You connect with me, and I will help you in connecting with Dr. Karunakaran. I repeat my number once again, +91 98307 01104, or else on Facebook you can send me your number. We will note it out and we will get in touch with you. You can also send your number to us on FB Live and we will get in touch with you. I hope I am very clear. You see, Shastho Bondhu number is very clearly now reflected on the screen. For anyone who wants to connect with us and you want help from Dr. Karunakaran, connect with us on that number. I would request my backstage team to flash this number for some more time so that people can note it. So if you can kindly flash this number again. Yeah, so people who are watching and who really have serious queries to Dr. Karunakaran, please do connect with me. I am always available from morning 6 o'clock to 11 o'clock in the night. You can connect me anytime and I'll be available to take your calls, as well as I'll be willing to accept all your WhatsApp messages. So whatever you have, do connect with me. I would be more than happy. Shastho Bondhu would be more than happy to help you, because Shastho Bondhu was created with the idea of helping people. You see, the name Shastho Bondhu means help and friend. We are friends of people who need treatment. So we do a very friendly way. We will not, we will do whatever is needed and very ethically. And all our, doctors as well as our partner hospitals like Green Eagles Global Hospitals are very, very ethical in their work. So you can be absolutely rest assured that whatever you need, only that will be done. আপনাদের যেটুকু প্রয়োজন সেটাই করা হবে, তার বাইরে আপনাদের কিছু করা হবে না। আমরা সর্বক্ষণ আপনাদের পাশে আছি। আমাদের স্লোগানই আছে, আপনার সাথে সব সময়। তো আমরা সব সময় আপনাদের সাথে আসি। Even when you come to Chennai, if you want to do your hotel bookings, and even Chennai Global will organize pick up and drop from the airport, so you get all facilities. So just connect with us, we will get things done for you. Thank you, Shampad, for connecting with us. Now, doctor, there is this question that people have, that how safe is spine surgery? Okay, just a moment. I have got a question from Babul. I just told you Babul has sent his problems. He's saying that বাংলাদেশ থেকে বলছি, আমার সমস্যা হচ্ছে যে আমার স্পাইনেতে বেক সাইড বা ঘাড়ের পিছনে। Okay, he's saying back side on his left shoulder neck. He has pain in his left neck. আমার ব্যথা করে এবং পেশার আবাহনও করে আরাম। Oh, he has muscle spasms. Okay, he has muscle spasms and he has pain in his left neck. And in Bangladesh, the doctors have advised him to do surgery. So I think the best thing, Babul, you have my number 98307 01104. You send me your reports, because I think it's very difficult for Dr. Karunakaran. Would you be able to suggest something on this, doctor, or should I ask him to send the reports? And then I think after seeing the reports, I think you would be able to give a better picture then. Or would you like to say something, doctor, on based on what he said?
Yeah, halfway through there is a disconnect. So I understood that he's got a neck pain.
And he has some muscle spasms. He's saying there's muscle spasms.
Okay.
ব্যথা
In the
করে
neck or the hands?
Yeah, I think he's not mentioned whether it's in the hands, but he's saying আমার ব্যথা করে এবং পেশার up down. পেশা মানে I think muscles up down করে, মানে there's kind of a up down. Yeah, like kind of muscular spasms, I think it happens. Yeah, and doctors have advised surgery.
Okay. So okay, so one thing is, yeah, as you rightly said, we have to have a look at the images, and if the symptoms have not get got better with physiotherapy and medications, yeah, he can go for the surgery. But he must undergo a good, effective trial of physiotherapy and medication, no intermittent stoppage of the course of treatment. So if he does that, then he can undergo the procedure. And I may not be the right person to say it now because I have not seen the patient. But based on the symptoms and his agonizing pain, which is always disturbing his routine, he must discuss with the doctor that whether that is the right option, and then he can take it forward.
Right. So, Dr. Babul, আমার মনে হয় যেটা আপনি করবেন, what my suggestion to you will be, you please send your reports to me on WhatsApp. My number is with you. আপনি হোয়াটসঅ্যাপে আমাকে রিপোর্ট গুলো পাঠান. We will forward it to Dr. Karunakaran, and Dr. Karunakaran will see that based on with whatever best he thinks, he will give his suggestion. And then based on that, if you want to come to India, if you want to come to Chennai, let us know. We will organize an appointment with you at Chennai Global with Dr. Karunakaran. Another very important part of Chennai Global, which I need to tell my friends of Bangladesh, I have got excellent feedback. Yes, yes. We will have later also, we will have such live sessions, Rushaida. Absolutely. You see, Doctor, as I told you, people have started demanding more sessions from you. So we will be having more sessions, Rushaida. We promise. Doctor, would you
Okay.
do more sessions with us if we want you
Yeah,
back?
definitely. We want to make
Absolutely.
more people better,
Absolutely.
more
Thank you. Thank you,
knowledgeable.
Doctor.
Yeah,
Thank you,
yeah,
Doctor.
yeah.
Now, I just was talking of Chennai Global Hospital. আমি সবাইকে একটু বলতে চাই, we have sent many patients to Chennai Global, and the kind of feedback we've received from them is awesome. Not only the doctors, the services that are provided, the kind of the people, the international patient department, the way they deal with the patients. Even for a lot of Bengalis who go from Bangladesh, they provide ইন্টারপ্রেটার্স আপনাকে, আপনি যদি বাংলায় কথা বলেন কোনো অসুবিধা নেই, ডক্টর করুণাকরণকে কেউ সেটা বুঝিয়ে দেবে, এবং ডক্টর করুণাকরণ ইংলিশে বললে সেটাও আপনাকে বাংলায় বুঝিয়ে দেবে. সো দে হ্যাভ ইন্টারপ্রেটার্স অলসো. সো দেয়ার ইজ লট অফ সার্ভিসেস, and Dr. Karunakaran himself will take care. When I inform him our
Yeah,
patient this is going,
yeah,
he will take care. সুতরাং আপনি জানবেন
definitely.
you are in safe hands, and you
Yeah,
can be close your eyes and go to Chennai Global. They will take
correct.
complete care of you, and they will give you very reasonable prices. It is not that they will give you such prices which is not affordable, because the idea of Shastho Bondhu and Chennai Global are very similar, that we want to serve people. Am I right, doctor? I mean, are we on the same
Exactly,
platform?
exactly, sir. Sir, it
Right.
is exactly correct. It is good that you brought out, because general trend is that they always think that the corporate hospitals are not are always after money. But this is a different culture. This is a different family. We are as a family in different departments. Work together, collaborate, and move forward. And the head the management is very clear that we have to be transparent in discussing what to the patient, and there is no hurry burry, and what we need is good outcome. The clinical outcomes are more importantly monitored by the management than anything else.
সো ইউ সি, বন্ধুরা, উনি যেটা বলছেন যে খালি ডাক্তার নয়, একটা ম্যানেজমেন্ট, একটা বোর্ড আছে যারা কিনা এই পুরো জিনিসটা দেখছে, দে আর ওভারলুকিং এভরিথিং. মানে doctor the doctor cannot do whatever he wants, or they cannot charge any. There is someone who's controlling this. So remember this, that you are going to go to a hospital like Global and Global is a part of Parkpay Pantai Enterprise. Can you give us a brief of what is this all about? Parkpay Pantai Enterprise, what is it all about? What is this?
Yeah, as you all know, this is an international group of hospitals. We are almost the second largest healthcare provider globally. So we are the largest healthcare providers, and like you would be familiar with the Mount Elizabeth Hospital in Singapore,
Yes,
which is
yeah,
the part of the Parque Pantai Group.
yes.
And in India, we almost got four centers sent across India, and all these are in major cities, contributing to the domestic as well as the international population. So, and the flagship hospital is in Chennai. So we are the brand ambassadors for clinicals uh, for the rest of the world from Chennai.
Okay. A very important input Dr. Karunakaran gave us, বন্ধুরা, আপনারা বাংলাদেশে সবাই খুব মাউন্ট এলিজাবেথ, everyone talks of Mount Elizabeth a lot in Bangladesh. So what Dr. Karunakaran is saying that this Gleneagles group, the Gleneagles
Sir, I can't
Global
hear you.
Group, can't you hear me? Hello, doctor, can you hear me? Can you hear me, doctor?
Hello.
Can you hear me? Hello, can you hear me, doctor? Can you hear me, see me?
I'm not able to hear you.
Have you muted any kind? I have not muted. I'm absolutely on
Shall
the
I
voice.
I'll just disconnect and reconnect, sir?
Yeah. You just disconnect and come in. I think that will be better. Yeah. So a very important thing what Dr. Karunakaran just said, মানে এক্ষুনি উনি যেটা বললেন, that the Gleneagles Global Group is a part of Mount Elizabeth. Mount Elizabeth is also a part of the Parkway Pantai enterprise. So আপনারা অনেকে মাউন্ট এলিজাবেথের কথা শোনেন, অনেকে বাংলাদেশ থেকে সিঙ্গাপুরে ট্রিটমেন্ট করতে যান। সেই মাউন্ট এলিজাবেথ যে ধরনের সার্ভিসেস বা যে ধরনের বা যে লেভেলের ট্রিটমেন্ট মাউন্ট এলিজাবেথ দেয় সিঙ্গাপুরে, you will get the same you will get the same level of treatment in India from the global group. So rather than going to Elizabeth in Singapore and spending so much of money, which you'll be spending much more than what would you spend in Chennai. So rather come to Chennai and get the same level and same standard, because I'm sure Pathway Pantai Enterprises has uniform standards all across the world wherever they have. So this is a uniform standard. So rather than going to Elizabeth and spending so much of money, come to Global Chennai and get the same level of treatment at a much lower cost. Doctor, am I right in what I just said?
Truly right, sir. We maintain very high standards because the management is the same, and the cost is the biggest advantage because we are in India where we can have the cost is more effectively managed. So that is the big plus.
Okay. Doctor, can you give us an idea, like approximately what could be the range of costs of various kinds of spine treatment? Like people have this query, say what is approximately, generally, there are a lot of treatments you just spoke of. So can you just, I'm not saying accurately you give us, just give us a fair bit of idea. It can range from this to this, for various kinds of invasive procedures.
Yeah. Mhm. You can keep this as somewhere for a non implant surgery would be around 1.5 lakhs with endoscope with the special equipments to 4.5 lakhs for screws and fusion like O-lift or T-lift or P-lift, any type of fusion procedure. And it can go up to 6 lakhs for scoliosis correction surgery. And in the neck,
Okay.
probably it would be around 3 lakhs for the neck surgeries.
Right. So I think this was a very informative thing what Dr. Karunakaran said, that more or less you have an idea that how much it costs to, it's a range. It's not like it's not 100%, এটা নয় যে এটাই হবে, but you get a range of price. It can range from 1.5 lakhs to around 6 lakhs is what the range is, based on your condition. আপনার conditioner উপরে, what is your condition? Based on that, the decision would be taken, and based on which your cost would be decided. But one thing is for sure, this is a cost, this is an investment for yourself, right, doctor? What is this cost? This is on yourself, based on which, what are the chances of recovery, doctor, when a person spends this kind of money, to get himself treated?
See, we should not, I think, look like an investment plan. Though, yeah, but basically everything boils around money. But it is something we must look at it as a once in a lifetime procedure. So it's only when your body is fit enough, your mind is in a better position to perform things. So I would say that you must be very happy to invest in these things, which is not measurable, because once your hurdles are cleared, you can, the sky is the limit. You can whatever you want, you can go reach whatever heights you want to explore and get back in exponential levels of you can amass wealth in exponential levels.
But doctor, I have
So
a small question for you, doctor.
yeah,
My question to you is: I have seen people who, even after operation, haven't recovered. Still they get the back pain. Still they get all the problems they had. They had their operation, but still they suffer. So, what is your answer? Like, what? How would you respond to this?
yeah. See, the problem is usually there is must be a realistic expectation after the surgery. One thing, if
Yeah,
it is a degenerative problem, okay, it is an aging problem, it is bound to have a wear and tear process. So to control it, the doctor or the physiotherapist would have advised to do pay attention to their body and not to overdo things like long duration sitting or proper exercising, including strengthening and stretching, and of course the regular follow up with the doctor. So if that is happening, then the process would be even more better. And as I said, the most often the error happens when treating somebody with just by looking at the image alone. And the image alone will not tell the whole story. If there has to be participation by the patient, tell in detail what are the symptoms, when are these symptoms disturbing them, and then you correlate with the image and your clinical examination. This I would keep telling again and again because that is the mantra or that is has to be done, which is now in the fast world is skipped and then they land up in trouble. These are some of the common issues which we face. And of course, there can be technical challenges like there may be error in the procedure or something may be there once in a while, but it is not always there.
okay, doctor, how safe it is to take neurological medicines, post operation for a long time? Is how safe, the neurological or the nerve medicines that you all give, how safe it is to have throughout your life or, for a long duration?
No. So, the whole aim is to reduce the medication and get back to the normal lifestyle. So, if somebody is going to after surgery, again there is going to be medicines. It may be for a purpose. So, it may be for a particular period of time for the nerves to respond. But for longer duration, if until unless the doctor says your condition is not like the regular case where you need to have the medicines, otherwise, the medicines have to be stopped over a period of time. There are situations, if under supervision over a period of time, you need to take medicines, then you take the medicines, not as self medication.
Okay, okay, fine. So how safe is spine surgery, doctor? How safe is it?
Yeah. See, today the technology is so advanced. Okay. Like as I
Mm.
said, they're trying to view structures has been crystal clear with an endoscope where you don't have to see even blood in the field and you see very clear structures, then the error possibility becomes very, very less. So, and the second thing is every step of the surgery is monitored or image guided surgeries. Like if I have to put a screw, I see it under navigation, and the navigation says you are going the right direction and you can proceed. And as I proceed, if I'm very close to the nerve, there is somebody who is monitoring the nerves, which does the spinal cord monitoring. He says, "Sir, there are signal changes, so you have to stop there." So we take another route and go in another direction and place the screws. So the vision is clear, the diagnosis is very clear because the advancements of imaging, the track in which we have to put the screws is under image guidance, and there is feedback from the other physiologist who says the nerves getting irritated. So there are multiple team which is involved during the surgery who says they start sending alarms. So I think this is the best time to undergo surgery and in good infrastructure, which is done under complete monitoring and lots of team effort. Whatever you have been saying, Mr. Indrajodi, that I am taking credit, but there is a big team behind me who is supporting in my growth, and that is the secret of our success, actually.
Doctor, why I was smiling when I was hearing you was you're looking like a pilot currently, with your white shirt and with your tie. And you actually, whatever you just said was like a pilot, kind of an autopilot. Autopilot gives all the signals to the pilot so the pilot knows which route he should take, which route he should change. So
correct.
you're looking like a pilot, and whatever you just told me was nothing like, you are a pilot and you are actually driving in the body and the pilot drives in the sky. So that's the only difference. You
Eh,
are in
eh,
the body and he's in the sky. So very
but
similar
exactly
to
the
that of a
technology.
pilot.
Yeah, the technology is same. Like it's a radar which controls the pilot to land, and we have similar radar in the operating room which controls us in landing on the exact target. Yeah, exactly right. So, by the thanks for saying me as a pilot. I feel very happy flying high.
No, no, actually, you're looking like one right now. And of
Okay.
course, whatever you
Yeah.
just said is very
Yeah.
similar to, that of a pilot. Okay, how does the quality of life change after spine surgery? Is there a qualitative difference in one's life after spine?
Definitely, definitely, definitely. The whole idea is to make them go to the next level or experience a better quality life. So, whatever we do, we make sure that they have a better quality life. And if it is not going to make them better, then there's no point in doing a surgery. So, we have to understand if the procedure which we have selected is going to help them, and if that is going to help them, they are better than what they are today. It's not that they always think after spine surgery, you're going to be bedridden, you're not going to be very active. And these sorts of thoughts need not come to their mind, because the whole fundamental idea of doctoring is to make them better and to be more productive and lead a happy
Okay.
life.
Great. Because why I'm asking this question, suppose I know someone who did trekking. So after trekking, he had back pain. He did operation. So do you think this person can get back to trekking again after a spinal cord operation?
Yeah, yeah, very much. Very much. He can get back to his previous level of activity, but this will be go through a process. So every time there is going to be a particular group of muscle which is to be focused and exercised and strengthened, and then he keeps do go through small distances. Then he go to a higher level, and he would be able to establish what he wanted to. That is the whole idea of surgery.
Okay. How important are exercises for a back pain patient? Exercises. How important are exercises?
Yeah, exercises is as important as oxygen for us. You cannot survive a surgical procedure without an exercise. So I always say, if your commitment is after surgery, you're going to do exercise. Then we do the plan of having a good result is going to be guaranteed. Otherwise, it's half 50% of my contribution alone will not take you
Oh, which means
further in the long run.
post operation, exercise is a must.
100%.
Right. So this is very important for all patients. Don't think that I have operated, so now I'm free, I can do anything. If you don't exercise and you say, I've spent money on operation, so I won't exercise, that won't do.
No,
You
no.
remember this, and then don't blame the doctor later. Don't say, you see, that was a bad doctor. Nothing happened. After operation, also, I still have my pain. It's because you didn't exercise. So don't blame the doctor, blame yourself. So remember this, like exercising is important not only for back pain. Shastho Bondhu says exercise every day because every part of your body needs exercise. So if not anything, go for a walk every day, go for a jog every day, take fresh air. All this is necessary to lead a healthy life. Okay, doctor, there's a common problem which people face, which is called spondylosis. So can you just give us an idea of what this is? Okay, Babul Hussain, doctor, again has said, uh, my problem spinal canal dural sac compression with canal stenosis at C5 C6 level due to disc hemi herniation. Yeah. So
Yeah.
what is this? Yeah.
What it means is that there are usually shock absorbers between two hard structures like the bones. We call that as a disc, and that is very closely oriented with the nerves. So that neural structure is within the spinal cord, and the disc is now compromising the space for the nerve. Let us say this must be the nerve space. It is now compromised in size because of the nerve encroaching into the disc encroaching into the nerve space. So the nerve space has become compromised. So the effective capacity to function effectively may not be there. But having said that, it always doesn't correlate with their size and the compression. If they are asymptomatic and clinically, if they're not having any symptoms, signs, they can still be periodically reviewed. So that will be based on the person who is examining this gentleman, Mr. Babul Hussain.
This gentleman, then this is the gentleman who spoke of the neck pain. He's the one who spoke of the neck
Okay,
pain.
so
As for me, yeah.
I would say that he would just continue with physiotherapy as long as he doesn't have any numbness, weakness, or persistent pain.
Okay, so Babul Mia, what doctor is saying that continue with your physiotherapy, and if you have persistent pain, then please do come to India. But if the persistent pain,
Correct.
মানে if it is just a on and off pain, মানে মাঝে মাঝে পেন হয় আবার অনেক সময় পেন থাকে না, then you can continue with your physiotherapy. But if it's a persistent pain that you're getting pain always, সর্বক্ষণ pain হচ্ছে, then please do connect. I think Babul Mia has also sent his reports to me on WhatsApp. So, doctor, I will forward it to you, all the reports, so that you can have a look and you can send a treatment plan accordingly. I think we are running out of time today. So, to wrap it up, I must say that we will get Dr. Karunakaran again. Lot of questions still to be answered. We have answered a few today, but a man of his, level, and a man of his, a legendary man like him, we cannot just, get him for one day. We have to get him for a few more days where he will answer a few more questions, and we will have a very good idea of what back pain is all about, what spondylosis is all about, and how we can stay better. Maybe doctor in one show will show some exercises also through which we can get relief from spondylosis pains. So we will do all that. Shastho Bondhu will do all that for you, and we promise that we are there with you always. We have been there with you always. We will be there with you always, and we promise to get you the best of doctors in India, the best of services in India, at the best of prices. Not only the best of doctors, best of hospitals, but at the best of prices. This is our promise to everyone who's watching this show and to everyone in Bangladesh. And of course, my friends in India also can connect with me. We will try our best to help you also. It's not only just for Bangladesh. My friends in India are also most welcome to connect with me. And I promise that I will try my best to help everyone whom I can help with whatever little, connect we have with the medical fraternity in India. Thank you very much, Dr. Karunakaran, for coming this evening, for sharing the stage with me this evening. And we will get you back soon, because you can understand lot of people asking for you, lot of people want to see you. Maybe we'll give a week's break, and then according to your availability, we will get you back again to this program. Thank you once again, Dr. Karunakaran, for joining this show. Would you like to
Yeah,
say something,
thank you.
doctor?
Thanks a lot. Thanks a lot. It was very well coordinated. I must congratulate you for all your efforts and your team who have been the backbone of taking care of this event going on with a great
But our
success.
bone is very strong. We
Uh,
don't need a surgery right now. We've got a strong bone.
yeah,
We
I
don't need a
always say
surgery.
that we are more into prevention rather than surgical. The whole idea
So
of
we've got a
meeting
very
this through
strong
this
team.
portal is, yeah, very good, very good.
Yeah.
Congratulations, sir. Thanks each and every
So
one
yeah,
of
we
the
don't need an
participants who have.
operation. So we are happy. And
Yeah,
I'm the pilot of my team. I know what to do. I negotiate. And of course, I've got very good co-pilots with me who are constantly giving me signals. So together we form a fantastic team. And this team will always serve
super,
people. That's our motto. Thank you very much, doctor.
super,
Stay well,
super.
stay happy,
Thank you
everyone.
very much.
Thank you. Okay, bye-bye. Bye-bye.